Did you know that by the time you finish watching this video, roughly 20 older adults will have received a dementia diagnosis? That's one every 66 seconds. But here's an alarming thought. What if the culprit isn't just aging, but something in your medicine cabinet? You've been assured these pills are safe, routine, even vital. Yet, fresh research is sounding a major alarm. A staggering 99% of seniors are unaware that at least one medication they consume daily could actually shrink critical memory regions in their brain by more than 28% in under a year. Let that sobering fact resonate. The pharmaceutical industry, for its part, has been privy to this information for decades. Still, they reap billions by distributing the very drugs that might be accelerating cognitive decline in millions of our elderly. A 2023 study in Neurology and Aging Research, for example, revealed that a single category of drugs heightened dementia risk by 49% in seniors after just 2 years of use. In this video, we're uncovering the 9 most hazardous medications that trigger rapid memory loss and dementia, categorized from frequently overlooked to outright brain damaging. And medication number 3. It's widely prescribed for a seemingly benign condition, yet it can diminish key memory centers in your brain, and you likely have no idea it's happening. Before we get into it, tell us in the comments, what medications do you take every day? Have you experienced sudden brain fog or forgetfulness? We're reviewing every comment and responding with tailored insights. Don't keep quiet. This information could protect your mental clarity. So, let's jump right in at number 9. And don't underestimate its placement. This drug is found in nearly every senior's home and could be scrambling your brain long before you notice any symptoms. Number 9. Diphenhydramine, often known as Benadryl. This is that familiar pink pill countless people rely on for sleep, allergy relief, or easing cold symptoms. It's affordable, sold over the counter, and likely sitting in your nightstand right now. You might believe you're simply using it to get better rest or alleviate allergies. However, within your brain, Benadryl can actively impair the hippocampus, the crucial region responsible for forming new memories. Benadryl belongs to a class of medications called anticholinergics. These drugs impede a vital neurotransmitter called acetylcholine, a chemical essential for your brain to create new memories and maintain alertness. As your brain ages, its dependence on every bit of available acetylcholine grows stronger. When this medication disrupts that delicate process, the consequences can be severe. A 2023 study in the Journal of Geriatric Cognitive Health revealed that seniors who regularly took anticholinergic drugs faced a 54% greater risk of developing dementia compared to non-users. So, how do you safeguard your memory? First, steer clear of any product containing diphenhydramine, particularly those marketed as PM, nighttime, or allergy relief. They're often just Benadryl in disguise. For allergy management, consider newer non-drowsy options like loratadine, commonly sold as Claritin. These alternatives do unreadily cross the blood-brain barrier and are significantly safer for long-term use in older adults. Never abruptly halt any medication, but also never assume that over-the-counter means it's entirely safe. Our next drug is frequently promoted as benign and stomach-friendly, yet it can disrupt the very nutrients your brain requires to remain sharp. Number 8. Proton pump inhibitors. Drugs like Prelosic or Nexium fall into this class. Commonly known as PPs, these medications are formulated to drastically reduce stomach acid, frequently prescribed for heartburn, GERD, and acid reflux. Many older adults remain on them for years, sometimes decades, because their symptoms recur the moment they stop. What's seldom discussed, however, is how PP has hindered the absorption of vitamin B12, a vital nutrient that shields the brain and supports memory, concentration, and emotional stability. A 2016 study published in JAMA Neurology investigated over 73,000 individuals aged 75 and above, concluding that consistent PPI users had a 44% heightened risk of developing dementia compared to those who didn't use them. By overly suppressing stomach acid, PPs impede the body's capacity to absorb not only B12, but also magnesium and calcium, both crucial for robust neural transmission and brain cell communication. Lacking these, neurons struggle to fire efficiently, leading to misfires, disorientation, and memory gaps that often mimic the early indicators of Alzheimer's disease. Yet, the problem runs even deeper. PPs have also been shown to elevate levels of amyloid beta plaques in the brain, toxic proteins that impair brain function and are considered a primary cause of Alzheimer's. The promising news is that safer options exist. If you take a PPI daily, consult your doctor about a gradual tapering strategy using H2 blockers like famotidine, sold as Pepcid. While not without flaws, H2 blockers are less likely to disrupt cognitive function. Additionally, chewing a piece of deglycerinated licorice DGL, a natural compound that coats and calms the stomach lining, can provide symptom relief without the cognitive risks. Next up is a medication frequently used for bladder control, yet it could be devastating both short-term memory and emotional stability. Number 7. Bladder control medications. Oxybutynin, marketed as ditropan, is a common prescription for seniors dealing with urinary incontinence or an overactive bladder. Ostensibly, it offers a pragmatic solution. No one wants the embarrassment or hassle of constant bathroom visits. However, this drug functions by inhibiting acetylcholine, the same crucial brain chemical disrupted by Benadryl. Unlike certain milder anticholinergics, oxybutynin more readily penetrates the blood-brain barrier, directly impacting memory centers within the hippocampus. This makes it especially perilous for older adults, particularly with extended use. A 2019 study in the BMJ discovered that individuals over 65 who took potent medications like oxybutynin for over a year faced a 49% increased risk of developing dementia, that's almost 1 in 2. What's even more troubling is that many seniors are never alerted to these cognitive side effects. They're simply told it will manage their bladder, not that it might hasten mental deterioration. The resulting harm is frequently misidentified as normal aging. Patients report feeling muddled, missing appointments, misplacing objects, or suddenly struggling to follow conversations. The link to the medication is seldom made until the damage is significant. So, if you're on oxybutynin and have observed any mental shifts, it's not simply your imagination, and you don't have to remain on the drug to maintain control. Thankfully, newer medications like mirabegron, sold as mirabegron, operate via a different mechanism and have demonstrated a considerably lesser effect on memory. These drugs do not block acetylcholine and are generally considered a safer choice for elderly patients. Number 6. Statins. These medications are among the most frequently prescribed globally, particularly for individuals over 60. Their primary aim is to reduce cholesterol and mitigate the risk of heart attacks and strokes. Simvastatin Zocor and atorvastatin Lipitor are two of the most prevalent. However, here's where the complication arises. Cholesterol isn't solely a cardiovascular concern. It's a fundamental requirement for your brain. Your brain is comprised of nearly 60% fat, and cholesterol is pivotal in forming and sustaining the myelin sheath, a protective layer that ensures smooth nerve signal transmission. When cholesterol levels are drastically lowered, you might inadvertently be depriving your brain of essential components it needs to function optimally. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 who had used statins for over 3 years experienced a 26% greater risk of mild cognitive impairment. Those on higher doses showed even more pronounced declines. What's particularly troubling is that some patients recounted experiencing sudden memory loss, describing instances where they couldn't recall names, recent discussions, or even well-known driving directions. It's crucial to note that not all statins impact the brain identically. Certain ones, like pravastatin and rosuvastatin, do not cross the blood-brain barrier as readily and are considered to pose lower cognitive risks. If you've been on a statin for years and are experiencing fogginess, forgetfulness, or confusion, it may be time to discuss a dose adjustment or alternative treatment plan with your doctor. Don't delay until the effects are irreversible. Acting sooner significantly improves your prospects of preserving your mental faculties for the future. Number 5. These include medications such as lorazepam, Ativan, diazepam, Valium, and alprazolam Xanax. Among the most widely prescribed for anxiety and sleep disturbances, they function by boosting GABA, the brain's natural calming chemical, which dampens overstimulation. Initially, they appear to be miracle solutions, soothing the mind, alleviating panic, and promoting sleep. Yet over time, these drugs transform into something insidious, a trap. A 2022 study published in the BMJ tracked over 8,000 seniors for 6 years and discovered that those who had used benzodiazepines for more than 3 months faced a 51% increased risk of developing Alzheimer's disease. This risk escalated further with long-acting benzos like diazepam, which remain in the body longer and build up in fatty tissues, including the brain. The effect is a type of chemical tranquilization that decelerates neural activity. This means your brain's learning capacity diminishes, becoming less adaptable, less effective, and more susceptible to confusion, memory lapses, and emotional blunting. Older adults on benzos frequently describe feeling enveloped in a fog, disconnected, or simply unlike themselves. The cruelest part is that when they attempt to discontinue the medication, withdrawal symptoms like severe anxiety, agitation, and insomnia can be intense, making the drug feel indispensable when it's actually the root of the issue. To address this, here's what's necessary. If you've been on a benzo for more than a few weeks, do not stop suddenly. This can be hazardous. Instead, collaborate closely with your doctor to gradually reduce the dosage. Alternatives like buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy for insomnia and anxiety, can help restore tranquility without sacrificing memory. Number 4. Amitriptyline, sold as Level. This is an older antidepressant, still commonly prescribed today for pain, insomnia, and even migraines. While it may initially seem like a versatile wonder drug, beneath the surface, it's one of the most potent anticholinergic medications still in active use. This means it aggressively blocks acetylcholinet, the chemical that helps neurons communicate, form memories, and maintain mental sharpness. In fact, its blocking action is so powerful that cognitive effects aren't just a possibility. They're an expected outcome with long-term use. A monumental 2015 study in JAMA Internal Medicine examined over 3,400 adults aged 65 and older, revealing that those who accumulated higher doses of anticholinergic drugs like amitriptyline over a decade had a 54% greater likelihood of developing dementia. That's far more than a minor increase. It's over half again the typical risk. What's truly terrifying is that many of these patients were never informed that the drug could harm their memory. They were often prescribed amitriptyline for sleep problems or nerve pain, only to slowly begin experiencing changes like short-term memory loss, difficulty finding words, and muddled concentration. It doesn't even require a high dose to cause issues. Even a low dose of amitriptyline taken nightly for several years can lead to a slow, imperceptible erosion of brain power. The damage unfolds silently, with no initial warnings or symptoms, just a gradual decline that mimics aging but is, in reality, drug-induced cognitive impairment. So, if you or someone you care for is on amitriptyline, discuss alternatives with the physician. For nerve pain, options like duloxetine or gabapentin might offer relief without the heavy anticholinergic load. For sleep, melatonin or low-dose doxapan, which has a far milder anticholinergic profile, can be used instead. And for mood support, newer antidepressants like sertraline or escitalopram are generally deemed safer for brain health. Number 3. Paroxetine, commonly known as Paxil. This is one of the most frequently prescribed selective serotonin reuptake inhibitors, or SSRIs, for addressing depression and anxiety. On the surface, it seems like a contemporary antidepressant, supposedly milder than older drug generations. But here's the crucial detail often overlooked. Paroxetine is the sole SSRI that exhibits significant anticholinergic properties, meaning it actively interferes with acetylcholine in the brain. This single characteristic dramatically sets it apart from its SSRI counterparts, like sertraline. A substantial 2021 review in Frontiers in Psychiatry analyzed the cognitive profiles of elderly patients on various SSRIs, concluding that paroxetine users exhibited measurable declines in short-term memory, verbal recall, and attention span within the initial 12 months. The study further indicated that seniors taking paroxetine were 30% more prone to showing early signs of cognitive impairment compared to those on other antidepressants. The irony is profound. It's often prescribed to stabilize mood, yet over time, it erodes mental clarity and emotional regulation. The solution here is direct and critical. Paroxetine should be entirely avoided in older adults. The American Geriatric Society has included paroxetine on its Beers criteria list, which designates medications potentially unsuitable for seniors. If you are currently taking it, consult your doctor about transitioning to safer alternatives such as sertraline or escitalopram, which are better tolerated and do not pose the same cognitive hazards. Furthermore, supplementing with B vitamins, particularly B12 and B6, can naturally assist in mood support. Number 2. Antipsychotics. This category is particularly unsettling, because many older adults aren't even aware they're taking an Medications like quetiapine, Seroquel, Risperidone, and olanzapine Zyprexa were initially developed to treat severe conditions such as schizophrenia and bipolar disorder. Yet, today, they are frequently prescribed off-label to elderly patients for sleep problems, agitation, or behavioral changes mistakenly attributed to dementia itself. You heard that right. These powerful drugs, intended for serious psychiatric illnesses, are being administered in nursing homes and hospitals to seniors who are simply confused, restless, or challenging to manage. The repercussions are dire. A comprehensive 2022 study in The Lancet Healthy Longevity tracked over 25,000 older adults, revealing that seniors given antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within 12 months, even without any prior history of dementia. Worse still, these drugs heighten the risk of stroke, sudden death, and profound sedation, which can lead to falls, hospitalizations, or permanent institutionalization. The mechanism is brutal. These medications suppress dopamine, a chemical crucial not only for mood and motivation, but also for executive function and memory processing. When dopamine levels plummet, the brain becomes sluggish and unresponsive. This is why seniors on antipsychotics often appear subdued, emotionally vacant, or zombified. Their personalities fade, leaving family members to grieve someone who is still physically present. Rectifying this situation begins with asking difficult questions. If you or a loved one is on one of these medications, inquire with the doctor about why it was prescribed and whether it's truly essential. In numerous instances, behavioral symptoms can be managed effectively through non-drug interventions, establishing structured routines, minimizing noise and overstimulation, addressing pain or discomfort, and optimizing lighting and sleep hygiene. When medication is absolutely indispensable, lower doses for shorter durations can mitigate harm. However, all too often, these drugs are utilized for convenience rather than genuine necessity. The tragedy is that many families are never informed about what these drugs do. They merely witness their loved ones decline, unaware that the cause is chemical, not natural. Number 1. Anticholinergic polypharmacy. This represents the covert danger almost no one discusses, yet it's a leading contributor to drug-induced dementia in the elderly. You might expect a single notorious drug to top this list, but the most perilous medication for rapid dementia in seniors isn't one pill. It's the silent, incremental impact of taking multiple medications simultaneously that possess anticholinergic properties, a scenario known as anticholinergic polypharmacy. Visualize this. An older individual takes diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain. Each of these drugs, on its own, might only cause mild memory issues, but when combined, their effects compound and the total anticholinergic burden skyrockets. This isn't just a theoretical concern. A 2022 analysis published in Age and Aging meticulously tracked over 280,000 older adults and discovered that those with the highest anticholinergic burden had a staggering 120% increased risk of developing dementia within a decade. That's more than double the risk. And here's the most unsettling aspect. Most of these seniors had no inkling they were even on anticholinergic medications. When you obstruct acetylcholine from various angles at once, your brain doesn't just decelerate, it begins to deteriorate. Neurons dwindle from underuse, synapses shrink, and the brain enters a hypoactive state that eerily resembles Alzheimer's. Correcting this doesn't demand a miracle. It requires a thorough medication review. Ask your doctor or pharmacist to meticulously assess your entire list of prescriptions, over-the-counter drugs, and even supplements for their anticholinergic load. There are online resources and specialized software that can calculate this cumulative burden. Once identified, you can collaboratively work to deprescribe, gradually tapering off unnecessary medications, transitioning to safer alternatives, and restoring balance to your brain's chemistry. This is the most empowering takeaway from this entire video. Drug-induced dementia is often reversible. When the burden is lifted, many seniors regain clarity, energy, and memory function within mere weeks or months. The brain possesses incredible resilience, but only if you give it a fighting chance. Polypharmacy isn't just dangerous, it's preventable, and that makes it the #1 hidden medical threat to the minds of our aging population. Now, we'd love to hear from you. Which of these medications do you currently take? Have you experienced any brain fog, forgetfulness, or shifts in personality since beginning a new medication? And are you prepared to speak with your doctor this week about a thorough review of your prescriptions? Share your experiences and thoughts with us in the comments section below. We truly value your input. Thanks for watching.